Today is May 3rd. Last week I had a few appointments with my radiation oncologist and my regular oncologist. The week prior, my radiation oncologist was on vacation, and he had ordered the CT scan and an MRI, and I guess he had left a message for my regular oncologist. So when I went in to see him on Tuesday, he said that he wasn't sure what he wanted to do with me yet because he hadn't heard back from my regular oncologist, and that he was apprehensive to do any more radiation on me because I react so strongly to it. He hasn't seen anybody react quite as badly as I do. So he was thinking maybe he didn't want to do any more because it looked like, according to the MRI, that the cancer that was on my cervical spine had shrunk a little, had responded to the hormone therapy. But I was still having a lot of pain, and when I went in that day, I was in quite a bit of pain. So he had me just kind of hang out in his office, and he ran upstairs to talk with my regular oncologist. And I guess she chewed him out because she said, I've already been in pain for several weeks, and that is not getting better, and it takes a very small amount of cancer deep in the bone to elicit that kind of pain. And I responded last time positively with radiation, so there should be no reason for him to delay that kind of treatment. So he came back down and was like, okay, well, I got chewed out a little bit, and it looks like she really wants you to do some more radiation in your cervical spine, so that's what we're going to do. And he wanted me to stay that day and immediately set up appointments, that day going forward. And I wasn't prepared to stay that long because I think there was like several hours later that they were going to try and get me in for radiation. So we tried to, kind of on a panic, schedule the next 2 weeks of radiation starting the very next day, which I think was Wednesday. I have 5 scheduled for this week, so Monday through Friday I'll have appointments, and then next week I'll have a couple more Monday and Tuesday. So when I went in last Thursday to see my oncologist, her first question was, did he finally get you started on more radiation? And I said, yes, it's underway. I haven't noticed any changes yet, but being treated. And she talked a little bit about wanting to add some more treatment on top of the radiation and the hormone therapy I'm doing. And I expressed to her at the time that I didn't feel like I had the physical constitution to do that. I've been dealing with a lot of pain lately, and today it's better. I resorted to using some cannabis oil, and that has finally made it stop. And I remembered that last time that was the only thing that actually finally made the pain stop without all the weird side effects. So I don't know why it took me that long to give it a try again, but I am feeling a lot better today. But I told her I really didn't want to add more on top. I just didn't have the constitution for it right now. I just couldn't do it. So she said we'll talk about it again in a couple weeks, but I don't think that's going to change in a couple weeks. I would really like them to do, another bone scan to see what kind of changes or results we've gotten. So I would kind of like to know for sure, how well this is working, and if it is, I don't see a reason to add more to it or make any changes. But I guess we'll see. I'll have to talk to her again in a couple weeks and see how she feels about that. Or the radiation for my cervical spine is a bit easier. It doesn't make me quite as sick. I'm not vomiting like I was before. I'm still nauseous a lot. And after a treatment, I'm usually pretty exhausted. It just wipes you. You don't really feel anything while it's happening, but a good 10-15 minutes afterward, the nausea hits, and then you just feel exhausted, like you've been up all night studying or something. It's weird. So I do a lot of sleeping while I'm having treatment, but hopefully next week there'll start being some improvement in my range of motion and my overall constant pain level, so I'm hopeful. I have a couple pictures of the mask when you do cervical treatment, they have to make sure you're completely stabilized so you don't move at all. So they have this big plastic, I think I mentioned before, mask that snaps to the table so you're like pinned down. But I got a couple pictures of that. I'll show you here. So yeah, that is where we are today. Said I have all week next week for more radiation, and then a couple days, Monday and Tuesday, the following week. And then I assume there's going to be another reevaluation, and they're probably going to wait a few weeks to see if any new spot lights up, or if there's, you know, what kind of changes present themselves. I don't know, everything seems to be kind of flying by the seat of our pants as we go thing. I mean, there is a plan, but I don't know, I don't seem to ever be able to get real concrete answers from any of these guys. It's a lot of, well, we'll wait and see. Well, we're not sure. Well, it could be this. And so, I don't know. But I would like them to do another bone scan pretty soon, just to kind of see on a whole, you know, where we are, because that first one was pretty scary. I'm really hoping that is improved. We'll see. I will definitely keep you posted. Thank you so much again to all my friends and family for all the support and encouragement and rides and food and everything. It has been so helpful. I appreciate it so much. I wish I could get out of the house more and spend more time with people, but like I said, I'm pretty exhausted a lot of the time. Once I get the pain management thing down, I think I'll be able to do more. I haven't really been out much because that's constantly a struggle, but yeah, I will keep you posted.